if you've ever felt a sudden tightening in the chest, heart racing, it's the sensation of not getting enough air, maybe some shakiness, this overwhelming sense of like fear, doom. Maybe you have experienced a panic attack. I'm Dr. Lewis, I'm a psychiatrist, and let's talk about panic attacks and panic disorder. What is panic disorder? What is a panic attack? So a panic attack is just like a single discrete episode of really intense fear that comes on usually suddenly and abruptly, and it lasts a few minutes to an hour, usually around 10 minutes. And panic attacks can happen in many different mental health conditions, so not just in panic disorder. Panic disorder is when someone is having panic attacks that are recurrent, they keep coming. Also, they happen without a clear trigger, out of the blue, and having multiple attacks within a month, and worrying a lot about future attacks, and also changes in behavior. So starting to maybe avoid going certain places because of a worry of having a panic attack, or not hanging out with people, or withdrawing from life, right? Once there are some changes that are usually not very good changes, that's another sign that that's actually a panic disorder. How common is this? So how common is panic disorder in the US? So full-blown panic disorder, right? That's like a bigger thing than a panic attack. Panic disorder, at any given time in 1 year, about 3% of everyone, of the population in the US. And lifetime, it's about 5%, right? So about, I guess, what is that? Half a person in 10. So 1 person in 20. The median age of onset is around 24. It often onsets in late adolescence, early adulthood. So I'm a child psychiatrist. I see lots of people. This is around like high school, college, maybe right after college. Very common time for panic attacks, panic disorder to show up. And it's more common in women than in men, as many other mental health conditions are. And panic attacks are different than panic disorder, right? So panic attacks can happen with all kinds of other health issues, even like certain medications can set off a panic attack. And about a third of the population, right? 1 in 3 of everyone will experience a panic attack at some point in their life. So many people may know what you're talking about because 1 in 3 will have a panic attack in their lifetime. Panic attacks and panic disorder can be really distressing. When I talk to my patients, I usually okay, panic attacks are a red flag, especially if they're recurring, we need to do something, right? It's such a difficult symptom. It can be so distressing and overwhelming. It needs to be addressed, right? It should not be left on its own just to keep going, because that can dysregulate the nervous system. That can also eventually affect life, right? And cause this withdrawal and starting to avoid certain things. Okay. What causes panic disorders? Why do people get these? And it's a combination of all kinds of different things. It's definitely, there's a genetic component. So having a family history, especially first degree relative, a parent or sibling, increases the risk, right? And we have some research from twin studies. And when you compare identical twins to heterozygous twins, or to dizygotic twins, fraternal twins, I guess, in common language. So identical versus fraternal twins. In the identical twins, it's about 30% that both twins will have panic disorder. And in fraternal twins, very low likelihood that both twins will have panic disorder. So clearly, there's a genetic component, but maybe like 1/3 is genetic. We also know that something might be different about the neurotransmitter system. So often it's the GABA neurotransmitter system, that's the benzodiazepines, that's like the calming neurotransmitters in the brain. Also serotonin receptor can be different. So genetics, neurotransmitters, but that's probably still like around 1/3. The rest of it is psychosocial factors, right? So panic attacks are often set off by something big and bad. Usually that happens in life. There's like tremendous stress, and this can be a manifestation. So losing a loved one, or like a physically dangerous situation, some kind of a trauma, an illness, right? Something like that can set off panic, like a panic attack for sure, potentially panic disorder. And we also know that children who have experienced abuse or adversity in childhood are more likely to develop panic disorder as an adult. Another thing to consider is smoking when young, like teenage years especially, will increase the risk for panic disorder in adulthood. There's also this thing about like temperament. So some people, some babies are born and they're just chill, right? And other babies are born, they're like, whoa, what's going on, right? So we're just born with temperaments. And people born with a more anxious temperament, kind of like that, that baby that startles and looks around in a nursery, are more likely to have panic and panic attacks. It's this whole bundle of just being like more reactive, more sensitive to stress, and more sensitive to threats and things that could be worrisome in the environment, right? It's this like sensitivity, is some hypervigilance, right? Tendency of thoughts to go in a catastrophic, like very negative direction. All of that can increase the risk for developing panic disorder. Another aspect of temperament that may play a role is behavioral inhibition, right? So being like the kid who's like not comfortable in like new situations, right? Like fearful, and more difficult to approach new people, new situations, and this just temperamental tendency to go towards fear may contribute to then later developing panic disorder. There may also be a risk factor around how the brain is put together, and specifically amygdala is our like fear center. So in some people, amygdala, maybe also hypothalamus, is just more jumpy, more reactive, right, to triggers. And people who have this more jumpy amygdala are more likely to have panic attacks. There are also like lots of different health conditions and mental health conditions which can increase risk for panic attacks, right? PTSD, anxiety, generalized anxiety, certain phobias, all of that. Also, like sometimes it's like a medical thing, like, certain medications, or asthma attack, or stopping a certain medication. It could also be like having way too much caffeine, right? Or like overdoing it with stimulants of any kind. And even smoking, right? So lots of different things can set off a panic attack. Okay, what are the symptoms? So this is like the DSM, right? Like the diagnostic manual has a clear way to figure out if it's a panic attack, right? So during the attack, if you have 4 of the following 13 symptoms, right? So at least 4. And that's heart, right? So pounding heart, palpitations, like fast heart rate is one. Then sweating or trembling or shaking, Then the sensation of like shortness of breath, or it's like hard to get enough air, this kind of like feeling of which leads often to hyperventilating. And then a feeling of choking, right? So some things like stuck in the throat. Also chest pain, right? So like, and that's often from all that hyperventilation. Nausea or like abdominal distress, feeling dizzy, right? So if you're hyperventilating, also eventually you're gonna get dizzy and faint. Chill or heat, right? So temperature dysregulation. And then these numbness and tingling sensations, which are also related to hyperventilating. And then feelings of unreality. It's like detached from oneself, detached from the place, kind of like really confused. And then a common thing I hear from patients is like fear of going crazy or losing it or losing control, snapping, right? And fear of dying. And these symptoms, they may peak within minutes and then leave, but the feeling of like exhaustion and fatigue, right, and kind of being shaken by the experience, that can last for hours. If those panic attacks continue, there's a risk that it will add up and will impact life, right? And one of the like bad things it can lead to is called agoraphobia. So agoraphobia is fear or avoidance or both of places, situations where it's difficult to escape, or which might be like very embarrassing, right? So that may be like not going to take the train or to the supermarket or to school, or eventually not going anywhere, right? Some people get really stuck in their home. Like panic disorder makes life smaller and smaller, right? As this like avoidance of more and more stuff, and life gets really small, and then it's hard to push out again. And it can also over time contribute to like depression or misuse of substances to cope, or withdrawal from people, right? And then just loneliness and missing out on relationships, disruptions in school, disruptions in work. So if you're having any of this is serious, right? It needs to be assessed, right? Like you need to have an assessment with a mental health provider. You need to like do a full like intake and history and figure out like what's going on. Is it panic disorder? Is it just a panic attack, right? So important to get help, especially if the panic attacks are recurrent. And important to get help early, to not like let this kind of dysregulate your whole nervous system. And once you see a clinician, they will present you with treatment options, right? So one of the key treatment options is therapy. Cognitive behavioral therapy is the top one. And, there are all kinds of workbooks and things you can do on your own, but working with a therapist is really great. There are also medication options, right? So I'll talk a little bit about the details. And there's also self-care, right? So that might be like less clear, but there's a lot about just taking care of yourself, eating, sleeping, having some movement, taking care of your social life, taking care of your body and physical environment. Of course, that will be helpful. So when thinking about treatment, often the decision between like medication and therapy is based on what do you want, right? So some patients are just like, I just want therapy, right? And some people are like, oh no, I want a pill. I'm ready. Like this is too much. So, and some people don't want to do talk therapy. They only want the medication, right? So we're all different, okay? And when someone is really having a lot of impact or like more severe symptoms, then it may be appropriate to do both at once, right? Medications and therapy and lifestyle, like everything we can think of all at once to get the situation under control, right? Especially if there's suicidality, if there's serious additional mental health disorders, right? Like if it's like serious and getting in the way of life, like stopping someone from being able to go to school or something like that, okay, let's treat it seriously, right? And there's some research guiding like what works better, but basically in research studies on this, it looked at like therapy and medications and like all kinds of different medications were about all the same in the short run, right? So whether you did CBT or took a serotonin reuptake inhibitor, let's say Zoloft, or took a tricyclic antidepressant or a benzo, right? In short-term research studies, which is mostly what we have available, they all helped, right? They all helped and it all looked about the same, right? So really it's about what resonates with you, what works for you. Of course, I always recommend therapy because that's something like you learn those skills and you don't lose them, right? Like once you know CBT, you know how to think that way, you have it for a lifetime, right? So I always encourage people to do therapy, right? Even if we also go with medication, let's not just do the medication, right? And of course, I will always also recommend lifestyle, right? Like, because if someone is like not sleeping, not eating, everything is chaotic, well, that's going to make recovery much harder. And there are other options too. So for people who have significant symptoms and don't have trouble with substance abuse, another option is benzodiazepines. So these are tricky medications, they're controlled, but they're very, very useful and effective, right? So it's good to have in the toolbox. It's not for everyone, but these medications, when someone is really having a hard time and needs help fast, right? Neither therapy nor antidepressants will give results fast. A benzodiazepine will, right? So within days, there's big improvement, right? So sometimes that's really helpful. And maybe that's a tool to use at the beginning, right? So maybe for like the first 10 weeks or so, maybe 12 weeks, 10 weeks, that's kind of like the ballpark until the medication and therapy kick in. Right? And then you try to get rid of the benzo or switch it from like, regular use to like, just hold a few pills, but don't take them, for a rainy day, right? For like an extreme situation, because sometimes just knowing I have a way out is enough, right? To like lower anxiety. So I have some patients who just have the same, few pills or bottle for years and they haven't taken it, but they are reassured by having it. Great, right? So it's a very different way of using a medication without actually using it, just having it as a way out, as a tool. And there are other medications too. So for people who do have trouble with substances, gabapentin is an option that can also help to like speed up and make things happen more quickly. So lots of options, there's in general this guidance to stay on a medication for at least a year after the symptoms are controlled. And when someone is really like had a really severe panic disorder, it might be to stay on a medication for like a couple of years, right? And then to taper off slowly and carefully. Overall, like take it seriously. This is like this is a serious mental health condition, requires care, right? So one panic attack, triggered by something, okay, if this is like a one-off, maybe it doesn't need treatment, right? But panic disorder, right? Recurrent panic attacks out of the blue, starting to avoid things, that needs to be addressed. You need a healthcare professional to help you out. Thank you for watching. All my love, and check out my other videos on related topics.